welcome to the Medical Mind. In today's video, we will be discussing monkeypox virus. We'll be looking at the overview, transmission, signs and symptoms, diagnosis, treatment and prevention, and the 2024 monkeypox outbreak. Mpox, formerly known as monkeypox, is an infectious disease caused by the monkeypox virus, an enveloped double-stranded DNA virus of the orthopox virus genus in the Poxviridae family, which includes variola, camelpox, cowpox, vaccinia, and other viruses. The two genetic clades of the virus are clade 1, which is the most severe, and clade 2, which is less severe. The 2024 outbreak is the severe strain of Mpox. Fatality rates are 1 to 10% for clade 1, which is endemic in West Africa, and clade 2 is less than 0.1%, which is endemic in Central Africa. The monkeypox virus was discovered in Denmark in 1958 in monkeys kept for research, and the first reported human case of Mpox was in 1970 in the Democratic Republic of the Congo. Now, let's talk about its transmission. Mpox is a zoonotic disease, which means it's a disease transferred from animals to man. Although various small animals such as squirrels and monkeys are susceptible, but the natural reservoir of the virus is unknown. Transmission of Mpox occurs from infected animals to humans from bites or scratches, or during activities such as hunting, skinning, trapping, cooking, eating animals, or playing with carcasses. Human-to-human transmission occurs as a result of contact with contaminated respiratory droplets, direct contact with bodily fluids or lesions, contaminated materials such as bedding or clothing. The virus then enters the body via a broken skin, the respiratory tract, or via mucosal surfaces, such as oral, pharyngeal, ocular, genital, and rectal. People can contract Mpox from contaminated sharp objects in healthcare. Now for the signs and symptoms. The incubation period is typically 7 to 14 days after exposure. Initial symptoms include rash, fever, headache, muscle aches, low energy, swollen lymph nodes, and back pain. Rash often starts on the face and then spreads to other parts of the body. The rash evolves through several stages, from macules to papules to vesicles to pustules and to scabs. The rash can appear anywhere on the body, such as palms of the hands and soles of feet, face, mouth and throat, groin and genital areas, and the anus. Symptoms typically last 2 to 4 weeks, but may last longer in someone with weakened immune system. Let's take a look at the diagnosis. Clinical evaluation is based on symptoms and history of exposure. Laboratory tests. Polymerase chain reaction, or PCR, for detecting viral DNA. Swabs can be taken from skin lesions, the oropharynx, the anus or rectum. Serology can be done to detect antibodies, but it does not distinguish between different orthopox viruses. Note that it's important to distinguish between monkeypox and other diseases, since they may present similarly. Therefore, detection of viral DNA by polymerase chain reaction is the preferred laboratory test for Mpox. Hence, testing of blood is not recommended. Let's take a look at the treatment and prevention. For the treatment, the goal is to take care of the rash, manage pain, and prevent complications. Early and supportive care is important to help manage symptoms and avoid further problems. Antiviral drugs are basically used. Tecovirimat is approved for treating smallpox and is used for Mpox. Cidofovir and vincidofovir are also considered for severe cases. Supportive care include pain management, hydration, and treatment of secondary bacterial infections. Now for the prevention. Vaccination. Smallpox vaccination offers cross protection against Mpox. Hygiene measures. Hand washing, using personal protective equipment when caring for infected individuals. Avoid contact with infected animals or contaminated materials. Isolating infected individuals to prevent spread. Public health response to prevent spread includes surveillance, which involves monitoring and tracking of cases to control outbreaks. Education, through informing the public and healthcare providers about symptoms, transmission, and prevention. Now, for your self care, whenever you see these signs, do the following: visit the nearest healthcare center for immediate care and attention. Stay home and in your own room if possible. Wash hands often with soap and water or hand sanitizer, especially before or after touching sores. Wear masks and cover lesions when around other people until your rash heals. Keep skin dry and uncovered unless in a room with someone else. Avoid touching items in shared spaces and disinfect shared spaces frequently. Use saltwater rinses for sores in the mouth. Take sit baths or warm baths with baking soda or Epsom salts for body sores. And for the don'ts, don't pop blisters or scratch sores. Don't shave areas with sores until scabs have healed and you have new skin underneath. For more information about Mpox, kindly contact your healthcare provider or Ministry for Health and Information. Thanks for watching and don't forget to like and subscribe.